Thank you so much. So it's a great pleasure for me to be here. And also because research is something that sometimes is not as incentivized as it should be. And because everything that we do in our lives is because someone did research in the past. So this lecture will have 3 different parts. One, I'm going to tell a little bit of my story. And this is not because this presentation is not about me, but I hope that it can inspire people to try to really do better and to dedicate their lives to research. So at least part of their lives. And so that's the reason I'm going to talk about. And after that, we're going to talk about research design, the initial step of any research project. And depending on the time, we may have one exercise to do or not. So I'm going to share my screen. I need authorization to be able to share my screen. Yes, Sarah, would you be kind enough to allow me? You are the host now. Okay. It says that okay, perfect. Okay, can you see my screen? How to use research to succeed in academia and in life. And so this is the topic of today. And as I mentioned, there will be 3 different parts. And I'm going to tell a little bit about myself, who I am, who is this person who is talking to you today. So I was born in a city called Joinville in Santa Catarina, is a province in the south of Brazil. Then I did my medical school in Curitiba, which is in another province, north. As you can see, I'm going north. And then I did my specialization first in pediatrics and then in radiology at the University of São Paulo. I did my PhD there as well. And after that, I went even north. I think it's probably now I am the northest part of the world that I can be. It's too cold to be more than that. And I did a fellowship at the University of Toronto and a master's in clinical epidemiology, also at the University of Toronto. And more recently, I did an MBA at the MIT in Cambridge, US. And this was another chapter of my life. And I'm going to tell a little bit about myself. This is myself at the age of 6, with my brother going in my first day at school. And at that time, I think this guy here was what I wanted to be in the future. I wanted to be a doctor. And for me, this was a doctor. I'm not sure if this is really the picture that you would picture, but this is how I saw myself at that age. And this is my mom, who also allowed me to do whatever I wanted in life and was something that I was very privileged for. And very early in my life, I was able to really face and feel the devastating effects of cancer. My mom was diagnosed with breast cancer at the age of 30 years. She was very young. She had 3 young children at the time. And these are some pictures of my family. And you can see here that we have only a beautiful picture. We didn't take any picture of my mom sick. I think maybe we deleted from our lives. We didn't want to see her that way. And she passed away when I was 13 years old. And this is myself, I think, when I was 13, just after my mom died. I wrote, I think, in English because I had English classes about what I wanted to be in the future. And I just mentioned, I think at that time, that I wanted to be working in a hospital, be able to help others. And I imagined having myself a lab. And I didn't want to be a famous doctor or scientist. I just wanted to improve the lives of others. So this is what I wanted to do at the age of 13. And I didn't have limits to dream. My goals were infinitive. And also, George Paulo Lemann is a Brazilian entrepreneur. And he always tells that we need to dream big. It takes the same amount of effort to have a small or a big dream. So I decided to have a big dream. And I hope everyone here also decides the same thing. So then in 2000, I went to the University of Toronto in Canada. And one of the reasons I decided to be there, not in the States, I was approved in some fellowships in the US as well, is because Robert Salter, who was a person that I admired a lot, was there. And he was a great mentor in the beginning of my career. It's very important to have a mentor, someone that you believe, that you really admire. And this helps you to really open your pathways for what you really believe. So then I started really doing research in arthritic rheumatoid arthritis, juvenile rheumatoid arthritis. This was my thesis of PhD in São Paulo, and I continued the research in Toronto. And after some years, I think you know that life gives many, sometimes we think that we decide about our lives. I think that life decides what we do. Someone invited me to do research in cancer. And then I started studying Li-Fraumeni disease, which is a cancer predisposition disorder. This is Dr. Fraumeni, and I had the pleasure to be with him a couple of years ago in Toronto. And David Malkin was one of the persons who was involved in the discovery of the genes for Li-Fraumeni. And he is my mentor. Now I work with him. So I have also the pleasure to work with him. So all these things that happened, I think a couple of years ago, we received $5 million to do some research in cancer. And I think although I never really planned to do this way, I think there is just this cycle of life. I started my life doing research in JIA, then I went to hemophilia because most of the funding was not available for common diseases, rheumatologic diseases and hemophilia. Industries were interested because the treatment was very expensive and there was more funding for research. And then after some time, because of the previous work, I was invited to participate in a stellar group of investigators on cancer. So each step in our lives lead to the next step and then to the next step. So the best predictor of success is to have success. When you have success, you're going to be more successful. And I think from the moment that I faced the loss of one of the persons that I loved most in my life, to dedicate to the early diagnosis of cancer were elapsed like many decades. But our dreams always come true, and we need to believe. So I just brought the other thing to show, I think, motivation, why we do research. And there are different types of research. There's basic science, there's clinical research, education, quality improvement. And you don't need to do only one type. There are very different ways and different pathways that you can really decide to do. And reasons to pursue research, why you want to do, because especially in countries that we don't have protected time for research, is very difficult. It depends a lot on your personal efforts. Sometimes you need to take time that you'd like to spend with beloved ones to do research. And this is very expensive for the cost of life. So having, I think, improving patient care, advancing the field, having a more interesting day by day, these are very strong reasons to do research. And sometimes we have limited resources. Unfortunately, today I will not be able to give you some tips about how to do it at another time we may discuss. You can really find ways that it's not very expensive and you can be very successful. For example, doing systematic reviews, meta-analysis, you just depend on you, maybe a colleague or a student. And I think usually they are the ones that have more citations in the literature. I did one meta-analysis when I started my career, and I think this was one of the 100 most cited papers in radiology. So this is something that it doesn't cost more than $5,000 to do that, or even less. So these are just something, and being a woman in radiology sometimes is difficult, more because I think sometimes we have to juggle between our personal and professional lives in a way that is very hard and very difficult, but it's not impossible, and you have wonderful role models that are able to do that. So for males who are single fathers is also difficult, the same way that is for women. So focus in imaging research, Dr. Janet Strive always think that you need to have focus. So it means you have even 2 hours a week that you dedicate to that, but you need to be very disciplined to do that. And it's very important to have money, space, and time. And sometimes what I feel is that if you have money, you have the power. So try to find whatever is possible. FAPESP, there are some caps, and I know that in the Spanish countries of Latin America, there are opportunities. Try to get some funding, because then you have more conditions to do some work, especially if you don't have administrative work. And when you have money, you have possibility of improving everything that is around you. So that are the rewarding experiences. Sometimes making the decision of one period of a week that you don't see patients and instead you are going to do research is something that you say, oh my goodness, I'm wasting my time, or I'm not doing what I'm supposed to do. But sometimes you are not going to see, to read, say, 50 x-rays or 100 x-rays, but you're going to benefit thousands, millions of people. So think about this. And sometimes I think what you do for research can influence the way people do clinical management or do clinical practice in different parts of the globe. So the impact of what you do with research can be immense, much more than you can see only in this number of cases that we read or interpret a day. So, and also I think you need to be very strong, because the beginning of a research career is very difficult. You receive lots of no's and nobody gives you money. No one believes in you until you, but you need to believe in yourself. If you believe in yourself, the others will as well. And this is what we get without planning. And this is what you get something with plan. I always think that everything that I plan in life, probably I got less than 50% that I plan. But if I have not planned, I would not get anything. So 50% or 25% of all the dreams that we have is already a lot, because then you have something out of it. So think about what is your dream and go after your dream for anything. Anything that you think that is wrong in your day by day, try to do something about. And try to look into local strengths, local resources, people who think like you, who can really help. Make a team, because we are nothing without a team. And try to find collaborators, and some people will not help you, but stay close to people who can help you. So this is my mission statement. And I think if you don't have one, think about what is your mission statement. So my mission statement is that I would like that children from communities all over the world would have the right to basic imaging tools, and also with time to high-end technology that is available in some countries. I wanted to make it available in every country for every child. It's not fair that depending on where you are born, you have more privileges than in others. So we can try to make a difference on that. And what is the formula for success? I would say that preparation is the most important thing. That's why everyone is here today. There is some factor of luck. Sometimes you can write the best grant, the best manuscript, but you just go to the wrong persons to review, and the person does not understand anything you wanted to tell. This is just bad luck. But don't, I think, be afraid. If it's not successful, try again. If it's rejected, try another place, I think, to submit your manuscript or your grant and move forward. And if you have a lot of patience and really believe in things and is very persistent, the victory comes for sure. So this is the formula for success. And now we're going to discuss specifically about how to think about a research project. So let's start with defining the research design. And probably most of the conversation today would be about what type of research design you are going to do. And this helps just the initial part of your project. So what are the characteristics of a good research question? First, it needs to be, I think it's written here, finer. It needs to be feasible, narrowed in the scope, interesting, novel, ethical, relevant. So some people think, and this is something that everyone in the beginning of the career does, and I did as well, and probably sometimes I even do, because we want to do so many things. We are so passionate about that we want to include everything that is possible in our research study. And this is like a recipe for failure, because we need to be focused. And although we have many ideas for one research study, we need to really see what is the most important thing that is going to be my primary question. Focus on that. After that, you can have, I think I'm going to tell you, you can have 2 or 3 secondary questions. But this is, I think, is about the focus in the research question. So this is an interesting thing. If you hit a bell with a pebble, which is this big stone, you get a small sound. But if you hit with a mallet, which is, I think, you get a very large sound. So trying to do a very focused research question really produces more benefits, more positive outcomes than if you try to accomplish it, to embrace the world. It's not possible. So try to have one research question and usually 2 to 4 secondary questions. And if you have other ideas, keep for the project to finish. When you finish this project, the next step can really address the other ideas that you have for your project. Try to divide the projects into different parts. So how to formulate a research question? This is a very basic thing, and I'm going to give you 3 examples. And I want you just to tell me which one do you think that is the best research question. One is power Doppler ultrasound able to determine the degree of synovitis in JIA? Is power Doppler better or worse than MRI for that? And which is the imaging modality that best determines the degree of synovitis in JIA? So which one do you think that is the best one? We don't have like a poll system, but just I think I wanted to, and probably I'm going to stop sharing my screen to see the first one, the answer is yes or no. The second one, the answer is better or worse. And the third one is which is the imaging modality. Who thinks is the first one? That the answer is yes or no? You just can raise your hands. Okay, I see 2 people. Okay, so this is for A. So we have, I see 3 people raising their hands. The second one is power Doppler better or worse than MRI? So we have also 3 people. And which is the best imaging modality? Who think that is the third one? 2 people. So we are almost, I think there is a match because people have different opinions about that. And in fact, the correct answer is the first one. And the reason why is the first one is because the answer for any research question should be yes or no. And this is something that people do not know. And if you write this in a grant that you put as a research question and doesn't have yes or no, it's going to be also a no, maybe even for the grant, even if it's a great idea. So usually the objective of the study, I think, is what I want to do, for example, to determine the degree of synovitis. But if you write a research question, you need to have yes or no as an answer. So now I'm going to give you just an example of a research question. And I think this is, for example, just using, I think, Pavlik harness for DDH, developmental dysplasia of the hip. And in this case here, we have I think it's a longitudinal study, I think, and just showing, for example, the patient in the very beginning without a harness. Then after that, and you can see that the left femoral head is completely dislocated. And then with time and with the use of an intervention, which harness is an intervention, we have better positioning of the cartilaginous femoral head. And so you can see what happens over time. So this is a project on responsiveness, so sensitivity to change for the use and intervention, which is the Pavlik harness. So this is just an example, a very simple example, and this is a longitudinal study, a prospective study. So this is just, I think, and what would be a good question, research question for this type of a study, if you had to really think about that? Did anybody think about what I think is the way that we usually think about having a research question? Usually we have something called PICO, population, intervention, if there is a control group, and the outcome. So these are the 4 parts of a good research question. Would anybody try to really see what would be a potential good research question for this study that I just showed? For example, you have babies, neonates, and I think you can even, I think, define, for example, what is the age group that you have. So this would be the population. The intervention, these patients will undergo the utilization of like a harness, a Pavlik harness. So this is the intervention. If there is a control group, I think I would say you can really try to use a control group. In this case, you may not need to use. And the outcome, what you want is that the alpha angle, for example, is going to really increase. So for example, if the alpha angle was less than 50%, we expect to have an interval change to more than 50% over a period of at least 2 months. So let's try to make like a research question with all this information of the PICO. Any suggestions? If there is no suggestions, I'm just going to suggest one. So for example, is a public harness effective to improve the alpha angle, which is the outcome, from less than 50 to more than 60 in neonates from a tertiary center, who come from a tertiary center during a period of at least 2 months or 8 weeks? So in this research question, so is public harness effective? So this is a yes or no answer question that has a yes or no answer and has all the different parts of PICO. Is this clear? So this is how to formulate a research question. Okay, so let's go back now. Okay, so now we have different types of research studies, and we can have emerging technology when you have pilot studies, retrospective studies, and more mature technology when you use, when you evaluate what is available in the literature, which is health outcomes, cost effectiveness analysis. And in terms of designs of the study, we have either experimental and observational studies. And we are going to discuss today the observational studies in terms of individuals, not populations, which would be ecologic studies. And for individuals, we have randomized control trials, cohort studies, case control, and cross-sectional studies. Now, over the next 5 to 10 minutes, I'm going to go through the different designs first to have an idea of the differences between them. And if we have time, we're going to have 1 or 2 exercises to try to see if we could understand that. So this is just a methodological quality of the studies, and the strength in causality is that the best design is the double-blinded, placebo-controlled, randomized control trial, and the weakest evidence is case reports, expert opinion, and people are really putting less value for case reports. I believe that for some cases it's important, but it's very difficult to find a room for case reports nowadays. Most journals do not accept. Only there are specific, I know 2 or 3 journals of radiology that accept case reports. And intermediate ones are retrospective trials and prospective trials. It's always, I think always we have better results when you do studies prospectively, because you can really plan in advance and control for biases, which are systematic errors, but it requires more resources, more time, as we're going to see here. So one thing that is very important when we evaluate any research design is to try to evaluate exposure and outcome. So what is this? I think sometimes it's a little bit confusing and difficult to understand. Exposure is when something happens. For example, let's say that in the case of Hiroshima and Nagasaki, when there was the bombing, was the exposure. The outcome is what happens over time. So for example, the development of cancer or on people who was exposed to bombing. So this is the outcome. And usually cohort studies, it means we evaluate over time, can be either prospective. If my research question starts here and I'm going to evaluate what happens with people over time. So for example, in this example of the bombing of Hiroshima and Nagasaki, the prospective cohort, if I had started my study at that time and evaluated over decades what happened with people, for example, the Framingham study is one example. And a retrospective cohort is that now in 2022, I decided to take people who lived in the area of the bombing and try to see retrospectively if there is a relationship between the development of cancer today and exposure to radiation in 1945. So this is something that would be a prospective and retrospective cohort. And case control is always retrospective. We have cases and we have controls, and we try to go backwards and try to see a relationship. Is this clear? We're going now to discuss a little bit more about each design. So it's important to know, to define what is the exposure and what is the outcome. And this is, I think, the difference between RCTs, which are experimental design, and the observational designs that we have: cohort studies, case control studies, and cross-sectional studies. I would say that most articles and most studies in radiology are cross-sectional. So I think when you evaluate diagnostic test accuracy, when you evaluate measurements, the validity, reliability, responsiveness, most of them are cross-sectional. And when you have experimental an RCT, usually you have an experimental group and a control group. And experimental group is a group that really takes a drug and uses imaging as an outcome measure. Or I think when you use two different IGT interventional techniques, for example, PICC lines and central venous lines, and patients can go either to one group or the other group. This is when you have this type of experimental design. And you also have a control group. So usually for the experimental group, we're going to test a new drug, a new intervention, and the control group is the placebo or someone who was not exposed to that intervention. The beauty of the RCT is that usually we don't, I think because the patients who participate in the study can go to one group and the other, and it needs to be ethical. So that's why we need to have an equal-wise point that I think we don't know which treatment is better, because if I know that one is better than the other, it's not ethical. But on the other hand, because they are randomized and there are different ways of randomization, the confounders are unknown. And that's why it's the highest quality in terms of design. And we have different types: single-blinded, double-blinded, open label. And this is, I think, to avoid to have confounding factors. The advantages is that this is the best study design in terms of methodology. Usually the biases are minimal, but it's very expensive, very time-consuming, and always we need to look into ethical issues and volunteer bias. So now we're going to look into the cohort studies. Either we can have, I think I'd say, for cohort studies, the difference between cohort studies and case control studies is whether I know or if I don't know the point of exposure. So for example, if I take the example of the bombing and the development of cancer because of radiation exposure, I know that there was the bombing. So I have a known point of exposure. So any design that I would have having this type of framework will be a cohort study. If I start at that point, is prospective cohort, or if I start now and go backwards, it's retrospective cohort. But I have a point of exposure. And this is exactly just explaining that we have exposed and not exposed people to a certain certain exposure at a given moment. And then I decide how I'm going to study what happens over time. Is this clear? And if I start the study here, then I'm going to go backwards, it's retrospective. And with these, we can also, I think we're not going to discuss the statistics here, but we have the 2x2 table. So we have test and disease, we have exposed, unexposed, affected and unaffected. And then we have, I think we are able to calculate relative risk, odds ratio, and attributable risk. I hope you're going to have another time to discuss in detail, I think, how to calculate that, but we use 2x2 tables for that. And the advantages is that we can understand the causes and the risk factors for something. For example, we can see that radiation can be a risk factor for the development of cancer. We can calculate, I think, a relative risk, attributable risk. It's time consuming as well. It's expensive because imagine to follow people over many years. I think this is very difficult. Blinded is difficult and there are disadvantages, but it's better than if you do a retrospective study that is not a cohort study. And case control studies are studies that I don't know my point of exposure. this is the difference between case control and cohort. And in this case here, for example, I start always at this moment, and I try to see whether there is any relationship for risk factor. So one example, I think there's a beautiful example, that is the adenocarcinoma of vagina that was caused by the exposure to estrogen therapy in mothers who had daughters, females. And this is, I'm just going to bring this example. It's a very old study from 1971, but with only 8 cases and 32 controls, they were able to show the relationship between the use of estrogen in the pregnancy by the mothers of females that developed adenocarcinoma of the vagina when they become adults. So this is something that is very interesting. You can see here that they tried also to see the relationship with X-ray, and it was not significant, but it was extremely significant for this. So this is an example of a case control study that they suspected that there was a relationship and went backwards and were able to do. They didn't know if there was a point of exposure at the time. So this is a difference between the cohort study. So it's important to have cases, controls that do not have the outcome. And the same way we have a 2x2 table, and usually we are able to evaluate odds ratio, not relative risk. Relative risk, we only are able to evaluate with cohort studies. And usually the case control studies are used for rare diseases when we suspect of having some risk. We have confounders, but usually it's cheaper than a cohort study. And the most important, the most common ones are cross-sectional studies, when we evaluate the diagnostic accuracy of 2 or 3 different imaging methods, and we compare imaging methods as well. And the advantages is that we can evaluate the prevalence of a disease in a population, but does not establish causality. So now I think we're just going to talk about surveys. I think this is something that is possible. The advantages are quick, economical. One of the disadvantages is very difficult to have a representative number of people who answer the survey, because usually people who answer either they receive money or are a specific population that they have interest in responding. In terms of case series, it may be interesting as well. I think, as I mentioned, it's a low yield in terms of evidence. And just, I think, to summarize, we have, I think, case controls. We don't have a point of exposure, and cohort studies, we do have a point of exposure and can be either prospective or retrospective. So this is what I wanted to tell you, and I just want to test ourselves if we could understand the message. So there's a lot of confusion about the research designs. I talk very quickly, but when you try to do ourselves, sometimes it's confusing. That's why we're going to test. And then is a pattern recognition. So I just have a curiosity if I think you can really define if this is an experimental design abstract or observational. So is this an RCT, or this is a cohort study or case control study or cross-sectional study? So just read, I think it's going to take a couple of minutes, and then if anybody comes up with an idea, one tip is that think about exposure measure, outcome measure, and research design. So just I'm going to have this screen here and give you a couple of minutes for people to read through. Would anybody, I'm not sure if you had enough time to go through or have an idea. I'm going to stop sharing. Would anybody think about a design? Is this an experimental design or an observational design? Who thinks is experimental design? Just raise your hand. Observational, okay. Anybody else? So 3 people raise their hand. Who are, what do you think, is observational or experimental? Who thinks is experimental? Raise your hand. There, we have 1 observational and 3 people who have raised hands. Do you think is experimental or observational? You can write in the chat if you want, observation, experimental. So I'm just trying to see what people think. Okay, we have 3 experimental and 1 observational design. Okay, so let's go back. And it's very important that we have this conversation to understand what we want to do. So just in terms of the exposure measures, it was a measurement perfusion diffusion mismatch in 3 groups. And 1 group was treated with 1 dose of microplasmin, the other one with a different dose, and there was a control group. And the outcome measure was the histochemical defined total infarct volume. So one important thing is that in this case here, I think they were randomized to one of these 3 groups. And this is something that sometimes is difficult only reading the abstract, and I agree that it may be confusing, but if you read through the abstract, they mentioned that they were randomized to one of these 3 groups. When you do that, I think we think that in this case here, it was a randomized control trial. So I just wanted to show you that it's not so easy as we think. Even I think to discriminate between RCT or an observational design is something that may take some time, and sometimes it's not so easy. There was another one that I can really share with you and send to Sarah. I think I cannot send the entire paper because it's copyrighted, but I think at least the abstract. And you can see here that is in this other example here. They mentioned cross-sectional design here, but they are trying to really quantify the accumulation of brain sodium and characterize the spatial location of sodium abnormalities at different stages of multiple sclerosis. So we had people with different stages of multiple sclerosis, but all of them were evaluated at the same time. So I'm just comparing different groups, but in a single time point. So in this case here is observational or experimental, and what type of observational design? If you want to take a look, I think you can take a look. Yes. It's a very short period of time, but if people think about this is an experimental or observational design, just compare with the other one. The other one, we had the rats that were randomized to 3 different groups. In this study, we don't have randomization. We have people from different groups are evaluated at a single time point. Do you think I see that some people mention observation, observation, observation? That's correct. Yes. So in this second example, I think we had exposure measures. I think there was also a control group. This is like the important thing, but we evaluated at the same time. And I think we're just comparing groups at a single time point, and there was no point of exposure. So this was a cross-sectional design with a control group. So this is just to show that it's not so easy. And when we try to conduct our own research, we have to have an idea of what we're doing. So this is just an example. I think that a cross-sectional study that does not establish causality. Okay, so I'm just going back to my mission of life. I think this patient here was the one who motivated me to dedicate to arthritis. I asked him to show this picture. He's older than his brother. He's 2 years older than his brother, but because of his disease, he had many difficulties in school. And I think this is something every time I really think about and try to redimension what I'm doing here. I always think about, I think because of patients like that although being radiologists and not seeing the patients sometimes, I think this is what motivates to go to work every day. And I think also, the possibilities of having people with so many outcomes that could be different if there would be a better healthcare and better tools to diagnose things earlier. This is something that is my mission of life. And I just want you to think tonight, what is your mission of life? What you are doing? Why are you doing radiology, and why are you here in this life? So when we have our mission of life very clear, written down in a paper, you really know, I think, and you have a better goal for what you're doing. So this is just Ayrton Senna, who was a pilot, a car racer from Brazil. And he also mentioned that his dream was to see his dreams becoming true through others. And probably this is another dream that I have, and I hope that many of you also have. So I think there is a Chinese proverb that mentioned that if you want 1 year of prosperity, you plant seeds. If you want 10 years of prosperity, you plant trees. And if you want 100 years of prosperity, you need to develop others. And so I hope you have enjoyed this talk and you have really seen, and I was able to inspire you to motivate yourself to do research. So thank you so much.